Today's lecture is about the treatment planning. So when you are going to do the clinic, especially oral diagnosis clinic, the treatment plan is the most important because after you check medical history or examination, final you have to make a decision to do the treatment planning for the most or appropriate for each individual patient. Okay, disclaimer because we have a lot of picture of the patients to compose this lecture. Purpose is not just for the lecture. Okay, this course, the purpose is need you to explain the consideration in the treatment planning, type of treatment planning, dental procedures, prioritization of treatment planning, and common treatment plan option. The best or the most important is that you should apply the knowledge to the clinical practice. Okay, this is all the topics or outline. Okay, I will start with the consideration in the treatment planning because if you need a successful treatment plan, you need to imagine that the patient walk to you and have some problem and need you to solve the problem. So we are going to do the purpose that is a successful treatment plan. You need to consider all of these factors. Start from the accuracy of diagnosis. So need the accuracy of diagnosis, you need the academic knowledge, right? If you don't have any knowledge, you cannot do that. The flexibility, the plan can flexible up on the condition of each patient, the needs of the patients, or their purpose, or their expectations. The satisfaction of the patient, possibility of the coming for the treatment. Because if you decide the very good, but the patient cannot come, so it's useless, right? The urgency also, the severity also need to think. Next is setting of the goal of the treatment by cooperate. You need to cooperate between the dentist and patient, not your own decision only. You need to listen to the patient and their opinion. Consider the maximum benefit of good oral condition. Function, aesthetic come together, restore the lost functions, emphasize in prevention and maintenance, and compromise treatment by may be necessary in some case. For example, only a plan for pain relief first. In patient with severe systemic disease, maybe you cannot do the complete treatment plan in one visit because there is some condition. Okay, this is a first question. Okay, now write on your paper. What is the most appropriate type of denture as you think now? Number A, you write A. Which design, RPD, bridge or implant? And number B, which design you can answer. Picture A, which answer. Picture B, which answer. Please write down. And the reason, a little reason why you choose RPD on the upper, why you choose the bridge on the lower or something like that. Okay, one is on your, you don't need to take photo because it's on your đó. It's on your handout. Okay. 1 minute, short question, but the big question is the last. Thăm thà เขาจะไม่เจอหนุ่มๆเลยก็เลยถามหาตอบอะไรเอ่ยเขาก็จะอะไรแล้วเพราะอะไรเพราะอะไร aesthetic first เนาะเขาก็แบบเบอร์บีRPD why ไม่รู้เหมือนกันแต่รู้สึกชอบ RPD ได้เรียนยังเขาสอนหมดแล้วอินท่า RPD อะไรอย่างเงี้ยเนาะเรียนหมดแล้วเนาะมี knowledge หมดแล้วโอเค write down a short reason, no? And the answer. Okay, I will move next now. I will move next. จะถามคนอื่นบ้างดีกว่าถามเพิ่มดีกว่าเนาะสองหนุ่มต้องถามผู้หญิงบ้างเนาะหรือถามคนที่ถ่ายรูปดีกว่า แก้ขำๆว่าถ่ายทำไมนะมันอยู่ในสไลด์เนาะโอเคhow about A answer why
Because it's only a single missing teeth and the adjacent teeth appear healthy.
Okay, and how about the price? This is more expensive than the other, right? So if patient don't have enough money, is possible? Maybe not, right? Because now we have only the not we don't have enough information that just simple your think why you thought that okay it's for the perfect aesthetic, right? How about the B plan? The B plan ไอ้หนุ่มคนนี้ B ตอบอะไร why it's RPD? Why don't need the implant?
It's just like multiple front teeth missing.
But implant also possible, right? Okay, no. It depends on many situations, so I will explain later. Okay, the consideration in the treatment planning. You need to consideration about the chip complaint, systemic disease or conditions, personal history, social history, and socio-economic status, dental history also, cause, pathogenesis, and prognosis of the diseases, appropriateness, and possibility, and treatment plan presentation also important. And okay, I will start with the chip complaint. Very important. When the patient comes to you, you need to ask until you know the chip complaint, because chip is more related with the pain or uncomfortable the most, but the others may be from the aesthetics or for the others reasons, but the most common is pain or uncomfortable. Patient need to cure or relieve that symptom before receiving other treatments. Treatment plan should start with solving the problem of chip complaint, and the rest of necessary treatments can be performed later. Now, for example, like a 38 years old male complain about severe pain on the lower left tooth around here, but when you see in the anterior, it looks more severe as well. However, the plan to start with that problem first, and the second maybe the second severe or third severity of the teeth, step by step. Okay, this is an example. And in some cases, the chip complaint is not an urgent problem. Patient can wait for correct that problem, but treatment plan can start with other problems which are more important. But you have to explain. Like for example, a parent of 7-year-old girl worry about crowding on the lower anterior teeth, but the parent cannot notice about the black one and will cause the pain soon. So you have to explain about, okay, your worry is about this thing, but okay, it takes time for do like a tooth arrangement or orthodontic treatment or something like that. But the more important is this one, the black one, can cause the pain soon. So you can propose and explain. That's why the chip complaint maybe not the first step to resolve, but the more severe should start with the plan, like to do the filling or to do the root canal or anything, depend on the situations. Okay. Next, about systemic disease or condition. Consider the current and past systemic disease or condition. Some disease can cause the damage of vital organ. Some disease or condition are life-threatening, for example, bleeding disorder. And risk assessment should be done before start treatment planning to reduce harmful and undesirable complications. for example, blood investigation. So we are the dentist, we are the doctor, we have a power or ability to like ask patient or send the patient to have the blood investigation or ask for the like a health checkup result or consult with the physician first before starting to do dental treatment. And be aware the spread of infection in patients with infectious disease like for example TB. Maybe they are coughing, have aware that they have TB or not. คนที่เพิ่งเข้ามาแสดงว่าไม่ยอมเข้ามาแต่แรกเนาะแต่มาสอบเนี่ยมาเนาะแล้วอาจารย์แจกกระดาษอะไรก็ไม่รู้ถูกไหมใช่ป่ะกระดาษที่เก็บคะแนนนะคะเนาะควิสนะไม่ได้กระดาษแล้วมีควิสแรกผ่านไปแล้วควิสถัดไปเขียนชื่อนามสกุลรหัสนะคะที่หัวกระดาษไว้แต่จะรอควิสถัดไปนะคะโอเคnext นะคะ consider drug side effects and drug interactions also important. So that's why you have to ask about medical problem and medication that patient are on. For example, anticoagulant, antiplatelet, immunosuppressant, also important drugs. Consideration to consult with physician before start the treatment planning in immunocompromised patients to prevent undesirable complication. For example, uncontrolled DM or immune disorder. And failure of dental treatment may be possible in patients with complicated systemic disease or poor prognosis. And consideration of expectation in treatment outcome is important in these patients because the success may be difficult. There is a lot of complications. For example, a 67-year-old male came with pain and moving of the upper left teeth, and when you examine, most of the teeth are severe peritonitis, moving and part accident and many things. But the patient are like a complication is a heart disease, diabetes, and hypertension. So, can you imagine that we can manage this patient to be like a complete or healthy dental condition or not? Have idea? Is it possible to do perfect dental treatment plan in this case? No, but no. Why do you think that is no? So how can you explain to them? Okay, เก่งมากนะคะ Okay, the severity of the teeth and medical condition. So maybe we can have we cannot do immediately everything. We have to wait or consult. Also, maybe patient expect a lot that you have to deal everything in one day, but we cannot. Okay, the personal history, social history, and socio-economic status. Personal history can reflect oral health, behavior, and attitude in oral hygiene care. And patient who has poor oral hygiene maybe you need to think about many reasons like a lack of oral hygiene care advice or ignoring or negative attitude in dental treatment or receive bad experience from previous dental treatment. Okay, so if you see the condition in the mouth like this, what should you do or you should add in the plan? Okay. เขียวเราเข้ามาแกล้ง Okay, when you see the oral condition like this, so what should you do or add in the treatment plan?
First of like scaling, maybe first to remove all the microorganisms before doing any invasive treatment to substance.
Okay, that is one of the good answer. How about the next answer? What should we add up?
Oral hygiene instruction for the patients to like have improved the oral hygiene.
Yeah, no, not only the treatment, but the oral instruction also important in this patient treatment plan. And the mental status, expectations, social status, career, and income are influenced in treatment planning as well. Like in some cases, such as you already know, as an actress, singer, public speaker, or famous person need more concern about dental aesthetic and better image. Like this, for example, have space in the anterior teeth, but if you are an actress, what kind of treatment plan you want?
Like concern about aesthetic or
Or like you need to do like a composite filling to close the gap, or you need it veneer or
hopefully the veneer is more like high aesthetic and better function.
yeah, maybe different, no? Because if the general patient maybe the veneer is more expensive, maybe they could not pay or don't expect the more beautiful. But if you are the actor, actress, or something that need more confidence, now you need another plan. And these factors should be considered for making appropriate treatment plan and acceptance from the patients. อุ้ยมาใหม่อีก2 คนอุ้ยมาเหรอจ๊ะ สอบไปแล้วไม่ใช่เหรอ8-9อ่ะ เนาะมีควิสไปแล้วด้วยนะวัน4 คนนี้จะมีคำตอบแค่ควิสหลังนะเพราะควิสแรกจำผ่านไปแล้วนะคะเขียนชื่อนามสกุลรหัสทิ้งไว้บนกระดาษนะคะเดี๋ยวเตรียมควิสหลังถ้ามีคำตอบเกินมาแปลว่าไม่ซื่อสัตย์นะ Okay, dental history, success or failure of previous dental treatment can be assessed by current oral conditions. Factors related with previous failure should be identified and considered in the new treatment planning. However, the failure may come from the lack of recommendation for mechanisms of prevention. For example, in this case, the loss of the crown, because the old crown has a secondary caries and crown broken. So the new plan, if you need to make the same thing, maybe failure again if you don't explain patient to good oral hygiene care, or you have to shoot the another plan like a removal because patient cannot clean for that reason. Okay, next, treatment plan must set to solve the cause of problem, which may vary as inflammation, infection, developmental disorders. Sometimes multi-expertise cooperation in treatment planning is needed in some diseases condition, for example, cleft lip and parent, may be require oral surgeon, orthodontist, and speech therapist. So you have to plan not only your job, but the related physician or doctor maybe need to add in the plan to consult or cooperate. Consider appropriate time for treatment in some type or some steps. For example, waiting for jaw development in orthodontic treatment. And ideal treatment plan cannot apply to every patient. Some patients have restrictions, for example, cystic disease, economic status, or time. Cooperation from patients, family also important in treatment planning of patients who are disability, elderly, having cancer, or serious disease. because you have the patient cannot walk by themselves, so the caregiver or cousin come together. So you have to ask a plan with the caregiver because how many days that they can take this patient to the clinic, how convenient, who brush. Patient can brush by herself or not, or you need a caregiver to brush. There's many conditions. The plan have more complicated. So the treatment plan can be modified until meets all the factors, but must based on acceptable and proper dental knowledge. Okay, for example, a 50-year-old female complained about her tooth mobility. From the picture you can see. And she asked the dentist about tooth stability, tooth rearrangement with no spacing and maximum smile aesthetic. Oh, need a lot. Is it possible? Do you think? Yes. You can do everything in this condition and you need. So patient expression a lot, right? But the ability to clean the condition of the mouth, maybe we cannot do that. So you can explain to the patients. And the treatment plan must be done before start the treatment. You have to deal with the patient that okay, with like this number one, step 2, 3, 4, 5, 6, and okay, deal, and then you start now. Offer the appropriate treatment plan for individual because patient number A may be different from number B with even the similar oral condition. Present the plan with confidence. I think every student have a high confidence, right? And emphasize on the necessity for treatment. That's why need to treat. For this picture, okay. Okay, for this picture, what is the necessity before do the denture to the patient?
Treat the inflammation of the gingiva.
You guess what is it?
Denture stomatitis.
โอ้เก่งมากนะคะโอเคเนาะ it looks นะเนาะ inflammation and it's a dangerous stomatitis Newton type 3 and you need to explain that patient must treat this now before do the new denture because they don't have pain. Maybe they ask, I need denture immediately, but we cannot. We need to explain. And prepare total information and explain the reasons. Now, why you do this first, why you do that second, why you do that third step. And explain the sequence of the treatment clearly. Let the patient know about expense openly. Because, okay, the price of the removable and the price of implant is very different. And in the our setting in the dental school, maybe you need to explain the price of treatment with dental student and the price with special clinic with the already the dentist. The price each work, how much the price, how about the visit. Provide information about time spending because how many visits to do treatment with the dental student, like for example, cleaning. รู้ไหมcleaning cleaning how many visits for the cleaning? More than yes, everything more than one, but how? Because the patient need to know that how many times that we have to he or she need to come.
Maybe you have to evaluate after each time.
In general, like gingivitis, common gingivitis. Or maybe 3 or 4 or 5, many visits. And for filling as well, one single tooth maybe need not only one visit, maybe 1 or 2 or 3. And how about the denture treatment? Do you know how many visits for the denture? If you want to do a denture to the patient, các bạn hỏi cho nó không ăn can. Denture now maybe 10 or more than 10 visits now. So you need to explain every step now to the patient now that okay, come to the dental student very cheap, but okay, each step maybe spend time how around this total. So patient need to calculate they can come or not, right? Okay, so present the treatment plan to the family member. Important. If the patient unable to make decision, now be very old or cannot come by themselves, and especially in the pediatric patient, now you need to explain to the parent, and the parent make decision, not the children make decision. Type of treatment plan. There's many types. For example, comprehensive treatment plan, limited treatment plan, provisional or tentative treatment plan, and alternative treatment plan. Comprehensive treatment plan or complete treatment plan cover all the problems plan after complete history taking, examination, and diagnosis. For the limited treatment plan, cover only the chief complaint. Provisional or tentative treatment plan is still cannot make the final diagnosis in some conditions because lack of important information must solve one problem and waiting for outcome before making the next plan. Alternative treatment plan is offer the alternative plan compromise and depend on limitation of some factor, for example, prognosis or expense. Next, for the dental procedures. The dental procedure is we talk about the systemic treatment, preparatory treatment, corrective treatment, and periodic recall, examination, and maintenance treatment. You need to plan, cover all. Systemic treatment consideration in patient with systemic disease, like a type of systemic disease. You need to know the severity of the disease, duration of the disease, receiving medication or treatments, and disease control. For example, if there is an uncontrolled DM, how about the importance? You cannot extract, right? You need to consult with the doctor or waiting for until in the safe level. That's why you need to know about the condition of the patient. And two types of the patient. First, they knowing their illness and under the treatment, and they deny medical problem and never do check-up. I think the second is important. The type 1, okay, the patient already know, maybe you need to consult with their physician if necessary for safety dental treatment. Consider systemic disease related oral condition or problems, and consider limitation in dental treatment due to systemic condition. Like, okay, they have a lot of oral candidiasis. Maybe you have to think, oh, is there any underlying? And you need to control before. And consider drug side effects, consider possible complication, and prepare for prevention and corrections. Consider the pre and post medications such as the antibiotics, anxiolytic drugs. Like a patient has a infection, but the common is okay, maybe they are on the severe infection state, and their diabetes. And you think about it, if you extract for like antibiotic prophylaxis may be dangerous. So you need to think about prophylaxis or post-operative antibiotic like this. This is you need to add to the plan. Okay, the type 2 patient. Now this is the most common patient that come to our clinic. Oh, deny medical problem but never check. So if you ask the patient and okay, I don't have any medical problem, but you need to ask, did you used to do you just check or have any medical checkup to confirm, and what is the last medical checkup now? And if you are not sure, you consider to refer the patient to consult with physician for further investigations, diagnosis and proper treatment before start the dental procedure in case of any sign or symptom of systemic disease can be detected like this. This is a many ecchymosis of purpura in the hand or in the skin or the multiple petechiae in the mouth. You have to, is there any problem about bleeding disorder or not? Okay. Next, the preparatory treatment for eradicate and control the disease like oral surgery, endodontic treatment, parental treatment, caries control, orthodontic treatment, treatment of TMD and treatment of oral lesion are in this phase. Corrective treatment is a step after preparatory treatment for correction and function like operative dentistry, prosthetic dentistry. Next one, periodic recall. After you treat, you need to plan about recall. Early detection because it's important because you can know about the early detection before disease progression and cause severe damage. And recall period depends on the prognosis, progression, treatment outcome, and patient-related factor. For example, oral hygiene. You can design recall about 3 or 4 months, or 6 months, or 1 year. It depends. Okay, for this picture, what should you plan to do the recall? เดี๋ยวถามคนข้างไหนอาจารย์เข้าห้องนี้ไว้แล้วนะส่งไว้ใหม่ In general, how many months we do the periodic recall? In general, patient, กี่เดือนละ 6 months, no? So, but in this case, maybe you cannot wait until 6 months, no? 3 or 4 months is better, no? But someone, very good RHE, like the dental surgeon, no? Very good RHE, man. Maybe 1 year is enough, right? Like that, right? Okay, prioritization of treatment planning. Okay, for comprehensive health care, sequence of treatment affect the treatment outcome. Now start with chip complaint, emphasize that, start with chip complaint. And next, eradicate the pain uncomfortable for the next plan. Consider severity and progression of the disease in the upper class, and consider the function, consider the aesthetic and the maintenance, step by step. Okay. The stabilization and disease control, the primary care, maybe you need to do first. Some case come with the emergency treatment. Emergency means urgent or life-threatening. Primary treatment, just not urgent, but they need to repair important function or aesthetic. And the secondary care, prevention, disease control, minor aesthetic correction, or restore the function. For example, okay, maintenance and monitoring and rehabilitation, they look back function and aesthetic. This is no any teeth, complete drug, and final we need to back function and return back the aesthetic to the patient. The final completeness. For example, which case need emergency treatment plan emergency เนาะemergency เลยอะไรนี่ก็ได้เนาะเพราะข้างหลังเขาดูบอลกันอยู่จะเห็นไม่เห็นนะแต่ไม่อยากจะพูด แต่พูดซะหน่อยก็ยังดูไม่เลิกAเอา A or B that need emergency treatment เพราะว่าผม
ว่าแบบต้องเหมือนโชว์เล่นมากๆแล้วก็ต้องจำเป็น
มัน look like threatening เนาะ How about the B B not emergency เนาะ but need faster มา faster plan เพราะว่าบอลกำลังจะชนะหรือแพ้ไม่รู้แต่จิตใจไม่ได้แล้ว
emergency treatment plan แต่ว่าอันนี้ไม่ใช่
อันนี้เขาเรียกว่าอะไรดีเรียกว่าอะไรนะ
ทางเจษฎา
Tooth fracture แต่ plan มันของ primary เนาะ primary treatment it's not emergency but primary but need urgent because it's aesthetic เนาะ we cannot smile เนาะ they need to wear mask all the time so you need to know the term but most of them need the priority treatment first common treatment option เนาะtreatment options are based on feasibility, possibility, effectiveness, prognosis. Treatment option in frontal treatment, dental caries, treatment, solving tooth eruption problem and tooth replacement. Okay, I think all the options you need to you learn from each specific lecture like a scaling OHI, replanning, frontal surgery, orthodontic treatment and frontal treatment extraction. You apply all the knowledge from each department lecture and come together to decide for each patient. For the reversible pulpitis, maybe you can remove caries, apply desensitizing agent, reduce premature contact, or a reversible pulpitis plan may be possible to do root canal treatment or extraction. And you have to think about the crown root ratio and oral hygiene as well. For the previous endodontic treatment with the failure, maybe you need the retreatment or extraction or dental caries. Now they observe intracoronal restoration, fixed restoration, inlay or lay of crown or extraction. Various options. Orthodontic treatment or extraction like this. There's many plans. Space problem can cause malalignment, proximal caries, aesthetic and phonation. Maybe you need to explain why you need this patient to do the denture. Maybe they don't care, they can buy, but okay, if you live like that, the tooth can move at malalignment and can cause the cannot clean it failure or the phonation problem. Treatment option may be removable processes, big processes or dental implant. So now before start final quiz now, the summary now related factors in consideration for treatment planning. Think about or look overall in the oral hygiene conditions, the chief complaint and urgency. Next, the expectation of the patient, the possibility of any plans that like you plan very ideal like a lot of implants but patient cannot pay or patient had a very severe medical condition that the operation or surgery is dangerous, maybe you cannot do that plan, and the economic status and the ability of the dentist that you can do by yourself or the plan is a refer to each specialist. And the ideal treatment plan cannot apply to everyone. Maybe just only provisional treatment plan, maybe just only the just supporting some problem. And the patient choose treatment plan by themselves with the guidance of the dentist, not your opinion and order that you need to do this or that. And the most important thing that I want you to remember that treat the patients as you treat yourself or your family member. Love them like you love your family. you will success in your career โอเคอ่ะเข้าสู่การควิสนะคะนะเดี๋ยวเวลาอีก10 นาทีให้เวลาทำเท่านี้แหละก่อนที่อาจารย์ท่านถัดไปจะมาโอเคนะดีไซน์ให้ดีไซน์ create appropriate treatment plan นะคะดีสิแบบไม่ต้องถ่ายหรอกถ่ายไปทำไมเนี่ยมันเป็นข้อสอบแล้วถ่ายทำไมเอาเหรอจริงว่าไม่เห็นเหรอเพื่อนฟังเหรอโอเคได้เพื่อนฟังอ่านนะเขียน treatment plan นะว่าเฮ้ยเคสนี้เราจะแพลนยังไงดีสเต็ป1ทำอะไร2ทำอะไร3ทำอะไรแล้วก็ให้เหตุผลนะ a 60 years old female นะ came to the clinic because her upper denture had fallen on the floor and broken นะใช้ไม่ได้แล้วนะคะ but it's an expectation she need a new denture before retirement ceremony in the next 3 months okay so medical history DM now diabetes mellitus but taking medication irregularly last seen a doctor 6 months ago and we know that FBS value was 300 milligram per and in the oral examination okay the space like in the picture and the general rhinitis and tooth 1-3 mesial has a dental caries okay now decide the best treatment plan best complete treatment plan that suitable for this situation of the patient มีให้ครบทุกเฟสนะสเต็ป1 2 3 4ทำอะไรนี่นะทำอะไรก่อนทำอะไรหลังนะคะ and okay for the type of denture นะก็ specify หน่อยว่าใส่ denture เป็นอะไรเป็น implant เป็น APD RPD หรืออะไรอย่างเงี้ยนะคะ with the reason เนาะหลังจากรู้ทฤษฎีแล้วมันต้องอย่างนี้มันควรต้องอย่างนั้นมันต้องชีวิตจริงก็จะเป็นคนไข้มาด้วยอย่างนี้ด้วยอย่างนั้นมีเหตุผลอย่างนี้ many factors เนาะ the plan maybe varies can change person by person okay this is just one